गुड आफ्टरनून एवरीवन। मेरी आवाज एकदम प्रॉपर आ रही है? एक बार बता देना, आवाज का प्रॉब्लम चल रहा है तो आप सभी को प्रॉपर आ रही है क्या? आप लोगों के कंफर्मेशन के बिना मैं जा नहीं सकती आगे। आवाज एकदम प्रॉपर है क्या सभी के लिए? चलो आज हम मेमोरी बेस्ड क्वेश्चन सॉल्व करेंगे विद कंप्लीट एक्सप्लेनेशन। फार्मास्यूटिक्स से स्टार्ट करेंगे 40 एमसीक्यूज के साथ। उसके पहले कुछ इंस्ट्रक्शन मैं दूंगी आप लोगों को, प्लीज इसको ध्यान से सुनिएगा। मेरी आवाज सभी के लिए प्रॉपर आ रही है क्या? इको भी नहीं होना चाहिए, आवाज एकदम क्लियर, आपको एक एक शब्द सुनाई देना चाहिए। Oh, I forgot this is English class. I'm really sorry. I'm really sorry. I was talking that whether I am audible, I should be completely audible. Before moving towards today's class, I'm going to deal with certain instructions. You need to hear that instruction. Before that, please let me know, am I audible to everyone present here? Am I audible to everyone who is present here? Please answer me. Am I audible to everyone here? Guys, kindly answer, then we can start with today's session. Okay, so I'll start. The very first thing, today we are going to discuss 2025 memory-based question. Please make sure you are not judging yourself based on this paper, whether you know certain thing or whether you don't know certain thing. This is a very first instruction I need to give you, that you should not, you will be not judging yourself based on this paper. Very first thing. For you, every question will be there. Every question, you just need to know every answer. That is it. You will do. There is a question which is displayed. If you don't know, don't try to don't try to force your brain to remember certain things. Don't try to force it. I'm telling you right away. It is just one day before examination. No need to worry. Just keep yourself as much relaxed as you can and just try to see, this is the question, this is the answer, this is the question, this is the answer, this is the explanation. That is it. These are just certain question which are there from the memory based perspective from 2025 NIPER JEE examination, and we will be dealing with those questions. These are simple questions are coming in front of you. You need to see the answer. That is enough. I am again and again telling you, don't try to force your brain to remember or recall the answer. Next thing, don't try to judge yourself based on this question today, because it is your examination tomorrow and I don't want anything which will decrease your confidence. Understood? So be very relaxed, in very relaxed mode, no notes making, nothing. Just sit on your bed or sofa, whatever it is. Keep phone in front of you. Look at the question. This is the answer. That is enough. Okay. From that perspective, I'm starting today's session. The very first thing is pharmaceutics. We are going to deal with total 40 MCQs from the pharmaceutics class. Very first thing, the HLB range has been asked. The HLB range or HLB value of the antifoaming agent. Antifoaming agent, simple, the HLB value has been asked. So we know the mnemonic as ODS, and they are talking about antifoaming agent, which is the very first category. So option A will be our correct answer. Understood? I am again telling you, I am not going to ask you what is the correct answer. I am just telling you which is the correct answer and what are the questions being asked. So you just need to see the question and let me give you the explanation. That is it. So 1, 3 is the range of 1 to 3 is the correct answer. Anti-foaming agent 1 to 3. The water in oil emulsifier 3 to 6. Then wetting agent, spreading agent 7 to 9. Oil in water emulsifier 8 to 16. Detergent is 13 to 16. Solubilizing agent is 16 to 19. That is it. Yes, good afternoon. Next question. They are simply asking about the BCS classification class 2 drug. How the class 2 drug has been classified. So a very simple trick which a very simple way which I remember is high, low, high, low, high, high, low, low. Okay, high, low, high, low, high, high, low is the trick which I used to remember certain things. The very first thing is solubility, then is the permeability. So class 1, class 2, class 3 and class 4. This is how I remember. You can simply remember the way you have made yourself remember, or by simply high, low, high, low, low. That's it. Class 2 drug, it has a low solubility and a high permeability. Low solubility, high permeability, option C will be our correct answer. Right? Next question. One more thing you can simply remember. In first class, the gastric emptying rate limiting step is gastric emptying. It depends on the gastric emptying. Second, depends on dissolution. Third, depends on permeability. And fourth, depends, it is like case by case basis. So please even remember the rate limiting step. Or recall, no need to recall. Schedule O, what is Schedule O? Simply our schedules. These are very easy question. Cosmetic standard given in Schedule S. Disinfectant standard is correct answer, Schedule O. We remember simply as a Dettol. Dettol is from the disinfectant category. So O is simply associated with Dettol has a O. O is simply associated with Schedule O. Standard for the ophthalmic preparation, Schedule FF. And standard for parenteral preparation. As such, we can count this in the Schedule C as well. Okay. So this is our correct answer. Next question, talc is used as binder, diluent, disintegrant and preservative. Talc can be used as, talc cannot be used as a preservative. The next simple one, it can be used as a diluent, right? It is not a disintegrant, it is not a binder. It can simply go in the case of diluent. So we should know talc is nothing but from the category of diluent. Simple as that. Next question. According to IP, which of the following can be used as co-solvent? Acetone, water, glycerine and benzoic acid. Please, one more thing which I need to make sure that people are not afraid of is, don't try to see the numbers here. Okay? Please do not see the numbers which are displayed here. Just see the question. There are total 40 questions we are going to discuss. This number are randomly arranged, not in a sequence. Please make sure you are not seeing that numbers. So as per IP, which is used as a co-solvent, what do you think? Which is the co-solvent? This is a simple glycerine is being used. Glycerol has been used as a co-solvent. Very nice. Simple case. Simple direct questions are getting asked. See, ethanol, sorbitol, glycerine, propylene glycol, all of them can be used as a co-solvent. Saccharine sweetness has been asked. What is the saccharine sweetness? Aspartame has 200 sweetness. Saccharine has 500 times of sweetness than that of normal sugar. So it is for aspartate and saccharine as the 500 times more sweeter. So option C is our correct answer. So cyclamate 70 times, mannitol 72 times, aspartame 200 times, then ACE-K, or it is also known as acesulfame K 200 times, then saccharine 500 times, sucralose 600 times, neotame 7,000 to 13,000 times. Understood? Please just don't force your brain to think. Just keep it as a simple thing which is happening here. Question is there, answer is, I am getting to know the answer, that is enough. Benzoyl alcohol used as a preservative is not typically used in injection. For which group? Adult, for children, for elderly or for pregnant women? Please remember, for children, benzoyl alcohol is not used as a preservative. Benzoyl alcohol is the antimicrobial preservative which is used for the multi-dose injectable. Why it is not used in the children? Please, because we know that they have not yet developed the proper organs are not yet developed, and so metabolism and certain other things are very much what I could say, very much in a random way. So immature metabolism, which is also known as gasping syndrome. Please remember what is this gasping syndrome. It is talking about the immature metabolism. So because of it, children are not able to metabolize it, and that's why we are not using benzoyl alcohol in the children preparation. Next case, contact lenses are typically made up of, we know two types of contact lenses, 𝚻 is one and PMMA. Now which one is PMMA and 𝚻 is the one. 𝚻 is for the hydrophilic one, right? For the hydrophilic one, that means they are the soft lenses. And PMMA, which is given here directly, polymethyl methacrylate, it is the Hydrophobic one. Hydrophobic one, that means it is the hard lenses. We need to remember that's it. So option D is our correct answer here. Simple. Next, a drug which has a high volume of distribution will exhibit high solubility, lipophilicity, extensive distribution to tissue, and high plasma protein binding. We can simply remember a drug, high dissolution rate or high volume of distribution, not dissolution, high volume of distribution. That means it will spread extensively to the every tissue, right? So option C will be correct answer, right? Option C will be correct answer because distribution rate is quite high. Option C is our the right answer. Orange peel effect is shown during which phase? Blending phase, coating phase, polishing phase, or drying phase? What do you think? Orange peel is nothing but a blister kind of seen on the tablet surface. Kind of blister seen on the tablet surface, and this particularly shown in the coated tablet during the coating stage. Option B will be our correct answer, right? So option B is our correct answer. During the coating stage, the bumpiness, like have you seen the oranges? How the kind of bumpiness you can see? That kind of bumpiness you can see on the surface of a tablet, and that's why the correct answer is coating solution. Sublimation in lyophilization occurs at which stage? Sublimation is direct solid to gas conversion. What is sublimation? Direct solid to gas conversion. So it happens in pre-treatment stage, primary drying stage, secondary drying stage, or freezing stage. So please remember it occurs in primary drying stage. Okay. Primary drying stage is the one where the sublimation of the ice under vacuum could be happening. Understood? Next. Which technique is used to determine the surface area and pore structure of pharmaceutical powder? Quantazole, Anderson pipette, optical microscopy, and Coulter counter. They are specifically talking about surface area. What do you think? What will be the correct answer? Quantazole is specifically used in the adsorption method. In adsorption method, you must have studied this quantazole, right? So this is the correct answer. Based on it, we can identify what is the surface area. Anderson pipette, the size could be known. Optical microscopy, again, size could be known. Coulter counter, again, the volume displaced. The volume displaced once the particle moves from the particle. Coulter counter method, again, it is about the size, right? So quantazole is the correct answer. You can see here, adsorption method, quantazole is used, and air permeability, Fischer subscriber is used. Very nice. The solubility enhancement of a caffeine by sodium benzoate is an example of hydrotropy, complexation, co-solvency, or solubilization. We know that this is the case of caffeine is being enhanced by sodium benzoate. Some additives been added, and whenever there is certain additives being added, it is the phenomena of hydrotropy. In a complexation, we simply remember cyclodextrin as an example. Co-solvency, co-solvent has been added. Solubilization, different kind of additives you can see which has been added. Okay, why? Due to the presence of a large amount of additives, this is called as hydrotropy. So option A is our correct answer. Increase in solubility of various substances: caffeine by sodium benzoate, ketoprofen by sodium benzoate and nicotinamide, progesterone by nicotinamide, riboflavin by nicotinamide, and urea. Next, calculate the angle of reforce theta if the height is 3.3 centimeter and the diameter is 9 centimeter. We know the formula, right? Theta is equal to tan inverse h by r. This is our formula. So diameter is given 9 centimeter. You need to divide it by 2 to find the radius. You will get 4.5 as the radius. So once 4.5 is the radius which you got, so theta finding is very simple. What is h? What is h here? 3.3 and here 4.5. And simply you need to do the calculation. Somewhere you will get the degree as 36.25 degree as the correct answer. Where does primary absorption of drug occur? Stomach, small intestine, large intestine, and liver. Primary absorption of a drug they are asking. What do you think? Which will be the correct answer? Absorption generally takes place in the intestine, and that's why option B, our small intestine, will be the correct answer. Remember, small intestine is the site where major site of absorption be happening. Inner phase in oil, in water, in oil emulsion. See, oil in a water, in oil. That means here, if I talk about this phase, so it is having dispersed phase. Dispersed phase is oil and dispersion medium is water. That means here oil globules is engulfed by water globule, and further this has been dispersed in the oil phase. So the inner phase is here oil. Option B will be correct answer. Right? Next question. Which of the following exhibit a non-Newtonian flow? Water, chloroform, castor oil, or emulsion? Exhibiting a non-Newtonian flow. A very specific example, emulsion exhibit a non-Newtonian flow. Option D will be our correct answer. Can you see here where it is written? Example, the Newtonian flow example is H2O, glycerine, chloroform, syrup solution and all. And here see, non-Newtonian flow, we have emulsion. We have, let me be shifted a little bit. Suspension, emulsion, ointment. All of them colloidal solution have a non-Newtonian flow. Okay, please remember this. Now, very specific and easy question being asked here. See, there are so many easy questions being asked. Don't be worried about how the examination will be happening. It will be in your favor itself. Okay, your hard work will be awarded. Don't worry. So, Maillard reaction will occur between amine and lactose, protein and sugar, amino acid and glucose, protein and enzyme. Simply, the amine containing drug is there. It will not be very much compatible with lactose because it will lead to discoloration. Furanaldehyde will be forming, which is discoloring the tablet. Okay, furanaldehyde will be forming, which will discolor the tablet. Next, tablet adhesion to the dye wall during tablet compression. Adhesion to dye wall. Okay, picking, sticking, capping, and lamination. When I talk about picking, it will adhere to punches. When I talk about sticking, yes, this will adhere to the dye wall. So option B is correct answer. Capping in the sense the crown is getting separated. Crown is getting separated, and lamination means layered separation. Layered separation, several layered separation is called as lamination. Simple. So option B is correct answer here. Next, bloom strength is a measure of strength of which polymer? Gelatin, starch, cellulose, and PVP. In a capsule formulation, you must have studied about gelatin. Gelatin has a bloom strength generally 200 to 245, right? 200 to 245 is the general bloom strength. To be very honest, bloom strength, we remember it as 200 to 245, or you must have even studied 150 to 250 somewhat range, right? Both of range is in the same way. Please remember that gelatin has a bloom strength. That means bloom strength is nothing but what I could say, the chain of gelatin polymers chain, right? The chain of gelatin polymers, the strength is determined by that particular strength of how attractive that the chain of gelatin molecule is. That is shown by the bloom strength, and gelatin is generally showing this bloom strength. Okay. Viscosity is 25 to 45 millipoise. 45, somewhere you must have seen 45 millipoise also. So you can remember that also. And iron content is 15 ppm. As per IP, if the solubility range of solute is 1 to 10 parts, it will be soluble, it will be freely soluble, it will be sparingly soluble, it will be slightly soluble. So you must remember 1 to 10. That means it not will be slightly soluble because it is kind of getting very less part of solvent is required to solubilize it. So it will be having a very good solubility. So somewhere option B will be correct answer. It is freely soluble. This is the table. We know this table. Very soluble, less than 1 part. Freely soluble, 1 to 10 part. Soluble, 10 to 30 part. Sparingly soluble, 30 to 100 part. Slightly soluble, 100 to 1000 part. Very slightly soluble, 1000 to 10,000 part. Practically insoluble, more than 10,000 parts. Higher the Osler's ratio indicate excellent flow, good flow, passable flow, or poor flow. We remember Osler's ratio starts from the value 1. Okay, starts from the value 1. It goes till the value 1.6, right? So higher the Osler flow, it is showing poor flowability. So option D is our correct answer. Similarly, higher the value of compressibility, again poor flow. Higher the value of angle of repose, again poor flow. Higher Osler ratio, poor flow. Every good friend, the mnemonic is every good friend prefer pizza very extra. Very, very poor is also known as sometimes extremely poor. You can even remember like this. Okay. Next, sedimentation is directly proportional to surface area, viscosity, density, and volume. What do you think? Sedimentation is directly proportional to. Sedimentation is generally proportional to density. More the density, more will be the sedimentation rate. So option C will be the correct answer. It is inversely proportional to viscosity and directly proportional to densities. Next, unit of first order reaction, simple. Second inverse is our correct answer. Unit of first order reaction is second inverse. Second inverse for first order, zero order is mole per liter per second. Mole per liter per second. And unit for second order is liter, mole inverse and second inverse. Please remember this thing. Next, Fick's law is used for dissolution. Fick's law is used for study of dissolution rate, disintegration rate, dissociation rate, and passive diffusion. What do you think? Fick's law will be used in which case? Fick's law will be used in passive diffusion. Okay. In a passive diffusion, you must have studied about the Fick's law. Here, the Fick's law of diffusion came into picture during passive diffusion, which is also known as non-ionic diffusion. Next question. Coating of 𝘎𝙬𝙎𝙎 Ne40D on tablet is done to prepare buccal tablet, sublingual tablet, control release tablet, and IR, immediate release tablet. Simple thing. Anything which is coated with 𝘎𝙬𝙎𝙎 or any other coated material, they are generally coming under coated tablet. Whether the tablet will be film coated, whether the tablet will be enteric coated, depends on the material which we are using. So this is all of them comes under the control release dosage form. Here they are not specifically asking you whether enteric coated is there or film coated is there. So simply the broad option control release will be our correct answer. Next, which ICH guideline provides stability requirement for a new drug substances? Q1A, Q1B, Q1C or Q1D. For Q1D, we remember it as a designing, matrixing and bracketing wala. Then Q1C is nothing but a dosage form for new dosage form. Here they are asking for new drug substances. Here for new dosage form, right? Here it is a photo stability study. Photo stability study. So which is left? Option A. Q1A is for the new drug substances. Option A will be correct answer. Please remember Q1C is new dosage form and not new drug substances. New drug substances is given in option A. Next, FSSAI comes under which ministry? Ministry of Agriculture, Ministry of Health and Family Welfare, Ministry of Consumer Affairs, Ministry of Food Processing Industry. Simply FSSAI comes under Ministry of Health and Family Welfare. Which ministry does FDA comes under? FDA will be coming under Ministry of Health and Family Welfare. Again, direct question being asked. Direct question, Ministry of Health and Family Welfare. Dipole-dipole weak interaction is also called as London force, Debye interaction, electrovalent force, and Kirchhoff forces. Dipole-dipole interaction is also known as what kind of interaction it is known as? What kind of interaction it is known as? It is called as Kirchhoff forces. Okay, Kirchhoff forces is our correct answer. It is dipole-dipole or Kirchhoff forces is the correct answer. Okay. Induced dipole is London forces. Induced dipole. Induced dipole, London forces. Induced dipole and induced dipole is a London forces. You can even remember this. And permanent dipole are capable of producing dipole and induced dipole Debye forces. Dipole and induced dipole is Debye forces. Both of them are induced. Then ID is London. One D and one ID is Debye. And Both of them DD. Then it is keystone force. The plasticizer which is used in capsule shell. Plasticizer is one which provides this flexibility also, right? So plasticizer which is used, silicons are there, glycol ester, tannic and glycerol. Plasticizers are glycerol, sorbitol, right? Propylene glycol or polyethylene glycol. Polyethylene glycol. So option D is our correct answer. Next, which method is used for synthesis of dendrimers? Divergent method, reverse micelles formation, cellular carrier method, and polymer drug conjugation. Synthesis of dendrimers. Dendrimers is a new dosage form, right? Which method is used? There are 5 methods for preparation of dendrimers. Divergent method is one, so option A. Then is convergent method, divergent method. The other 3 methods are hypercore and branched monomer method, double explanation and mixed growth method, other accelerated growth techniques. The Reynolds number, widely used to classify flow behavior of a fluid, is a ratio of which one of the following? Inertial force to gravitational force, inertial force to viscous force to inertial force, and viscous force to gravitational force. What do you think is correct answer here? Simply classify the flow behavior. So initial force to the viscous force will be the correct answer. The range, the practical range, if the Reynolds number is less than 200, the flow is laminar. If the Reynolds number is more than 4000, the flow is turbulent. If the Reynolds number is 2000 to 4000, then the flow is laminar or turbulent. Both of depending upon that. So please make sure lesser the Reynolds number, more laminar is the flow. Okay. Inertial force to the viscous force is the its flow behavior. What is the required floor area for running a pharmacy of wholesale distribution? So for retail we have 10 square meter. For wholesale we have again 10 square meter. And if it is combined one, then it is 15 square meter. So option B will be correct answer. Next, which grade of MCC is most commonly used for direct compression? Methyl cellulose, which grade has been used? Avicel pH 101, lactose monohydrate 1, talc 1, or PEG 400. Which one? Avicel. Avicel pH 101 is generally used. Microcrystalline cellulose. See, by the name also you can determine it is cellulose derivative. And I told you that whenever the word cell is coming, it is associated with cellulose. So this is how the Avicel is pH 101, which is used for direct compression. Type 1 glass is also known as borosilicate glass, regular soda lime glass, treated soda lime glass, and none of the above. Type 1 glass. Type 1 glass. Yes, it is borosilicate glass. Treated soda lime glass is what? Type 2 glass. Type 3 glass is soda lime glass. Type 4 glass is general purpose soda lime glass. Okay. Water attack test for type 2. And rest is powdered glass test. How many years should a factory premises be painted and refurbished? 5 years, 2 years, 10 years, or any guesses if you need to make? Then what kind of guesses you will be making here? No need to guess this kind of question. Please remember, no need to guess such kind of question where your negative will be going to high. So if you are not able to eliminate any option, don't try to attempt those questions. 5 years is the correct answer every 5 years. Where there are not painted or varnished, or where they have smooth impervious surface, be cleaned at least once in 14 months. In any other cases, be kept whitewashed or colored wash, and the whitewashing or color washing shall be carried out at least once in 14 months. Please remember this. Which marker is used for measuring the volume of plasma? Deuterium oxide, mannitol, Ewans blue and inulin. You must have studied this. For volume of plasma, we have Ewans blue, right? Ewans blue is for the volume of plasma. Plasma, Ewans blue, idocyanin green, then iodine 131 and albumin being used. Then erythrocyte, chromium 51, extracellular fluid. We have rapinose, inulin, mannitol, total body water, deuterium oxide, and antipyrine being used. The major constituent of the aftershave lotion is emollient, antiseptic, alcohol, and perfume. Simple. In aftershave lotion, the major constituent will be our alcohol. Okay, alcohol is the major constituent in aftershave, which serve as the antiseptic. It should be immediately used, immediately seal the cut and blemishes from infection. Subsidence in suspension describes settling, formulation, rheological property or interfacial property. Subsidence is nothing but sedimentation or settling itself. So option A is our correct answer. Next, total 10 MCQs from the pharmacognosy will be studying here. Pharmaceutics 40 MCQs been done. Now, pharmacognosy 10 MCQ. Shikimic acid pathway is an important in synthesis of valine, tyrosine, proline, and methionine. So we know that shikimic acid pathway been used in the synthesis of tyrosine. B is option, correct option. Tyrosine, in the synthesis of tyrosine we can use. In the synthesis of phenylalanine we can use. So this is how is the correct answer. Tyrosine, phenylalanine, and tryptophan. PTT is been synthesized from shikimic acid. Which among the following does not contain anethol? Phenyl, anise, holy basil, and all of the above. So phenyl has the anethol, anise has the anethol, but holy basil do not have anethol in it. Option C eliminated, and hence our correct answer. Okay, holy basil is nothing but our tulsi, and it is obtained from Ocimum sanctum. Lepidae family has a eugenol 70%. When I talk about anise, so it is having body trichomes, then anethol 90%. Phenyl, Phenicum vulgare, then carminative, it is used as carminative, and 50% anethol you can see here. For which of the following alkaloid Mayer test is negative but murexide test is positive? Indole test, indole alkaloid, isopinolone, quinoline alkaloid, purine alkaloid, or propane alkaloid. Murexide test is generally performed for, first of all, the purine alkaloid is correct answer. Murexide test is generally performed for purine alkaloid, and you must have studied about caffeine, theobromine, theophylline, all of them. Right? So option C is correct answer. Caffeine, theobromine, theophylline is the purine alkaloid. These are weakly basic alkaloid and do not give positive Mayer test. Next, which drug is obtained from the marine source? Agar-agar, Cassia angustifolia, cantharide, and asbestos. Which of the following is obtained from marine source? This is a mineral source, asbestos, cancel. Cassia again, plant source, cancel. What is left? Agar-agar or cantharide? Option A, agar-agar is our correct answer. Right? Red algae is the one obtained from the marine red algae seaweed, which is called as, it is obtained from it. Yes. Next, rancidity of oil is detected by iodine value, saponification value, peroxide value, acetyl value. We know that the rancidity generally of oil is detected by the peroxide value. Acetyl value, saponification, peroxide value, the rancidity occur generally cause increase in the peroxide value. Whenever there is a rancidity, there will be increase in the peroxide value. Okay. Rancidity increases the iodine value as well. Please remember that also. Next, matchstick test is positive for amla, balls, catechu, and myrobalan. We generally perform it for tannins, right? Here the correct answer becomes catechu. Option C is our correct answer. For catechu, matchstick test positive because where is a presence of fluoroquinolone, the matchstick test will give you positive result. Active constituent of rhubarb: rain, barbeloin, ellagic acid, and ferulic acid. Rain is the one which is the active constituent present in rhubarb. Option A is correct answer. Sorry. The main active constituent rain, imodine, alomodine, and trisophenols. Choose the drug containing indole alkaloid, belladonna, basaka, ergot, and opium. Choose the drug containing indole alkaloid. Simply here, ergot is the one which having the indole ring in it, and hence the indole alkaloid one. We have pyridine and piperidine, tobacco, areca, lobelia, propane, belladonna, datura, strontium, 𝙂𝙋𝘼𝙏, fiducia, and pucca, quinoline, cinchona, and camputica, isophenoline, opium, ipecac, curare, indole is ergot, nux vomica, rauwolfia, vinca, and physostigma, imidazole is pilocarpus. Then we have a steroidal, veratrum, curchi, ashwagandha, alkaloidal amine is ephedra and colchicum, urine alkaloid, tea, coffee, cola, and cacao, cocoa. Then glycoalkaloid solanum, quinazoline basaca, terpenoid actinide, and pyrazoline pepper. I am just making you go through all of them so that your mind recollect it in the examination. Which of the following plant rhizome is not used for extraction of crude drug? Ginger, there's Dioscora, then turmeric and saffron. Which of the following plant rhizome is not used? Okay. Rhizome. Saffron is not a rhizome part, so option D becomes incorrect one. Saffron is the corn. Corn is being used. Then bulb for squill and garlic bulb is there. Tubers is jalap and aconite, and rhizome is for the ginger, turmeric, and dioscora. The aroma of clove is due to presence of resin, methylamyl ketone, eugenol, and methane. The aroma of clove is due to methylamyl ketone. Methylamyl ketone. Please remember this thing. Aroma is due to methylamyl ketone. And the volatile oil is colorless, pale yellow in color, consists of a phenolic substance which is called as eugenol 80 to 95%. Next is other subject, total 9 MCQ we are going to deal with it. Just more 9 MCQs are remaining. Oh, thank you so much. Other subject, total 9 MCQ. See, again I am telling you, don't be afraid of your examination. Your hard work will be rewarded. Try to keep yourself as much relaxed as you can. Right? Be as much relaxed as you can. All will be happening for you in your favor itself. Whatever will happen in your right. Now, total line again. I am telling you, don't look at the numbers which are given here. They are slightly not arranged in the sequence. So, the building block of DNA are sugar, phosphate, both A and B nucleotide. Very simple. अजून नाही संपलाय शेखर अजून नाही संपलाय टाइम आहे अजून इंटरव्ह्यू बाकी आहे शेखर what about you? Yes. What is the correct answer? Yes, nucleotide is correct answer. Based on nucleotide, sugar, phosphate, and the phosphate group, pentose sugar, and this nitrogenous bases. Okay. Next, which of the following vector is used in a crop improvement and crop management? Agarobacterium, plasmid, cosmid, and phasmid. Vector used in crop improvement and crop management. What do you think? What will be the vector? Simple. We used agarobacteria, right? Option A is correct answer. Next, the bacterial cell are at their metabolic peak during lag phase, log phase, stationary phase, and decline phase. अच्छा होतो. Don't worry, something great will be happening. काहीतरी चांगलं होणार शिखर, don't worry. The things which are destined in your life will be happening anyhow, any case. If you are destined to be at somewhere, you will be at that particular place in this lifetime. Always remember this. Okay? Always remember this. Shekhar, even you. Don't get disheartened. Everything happens for a reason. So, bacterial cell at their metabolic peak during metabolic peak metabolism at the highest in the log phase. Log phase is the exponential phase, stationary phase where everything gets saturated, and then is the decline phase, death phase. Next, which antibody first grow or build up or produce against antigen? IgG, IgA, IgM, IgE. Very nice. You will be qualifying NIPER also. Don't worry. Give your best and don't stress. Give your best and don't be in stress and anxious mode. Take deep breathings. हा सर्वांना म्हणजे to everyone who are present in this session, I also told you last time, again telling you, take a very deep breathings whenever you are sitting in the examination hall. Don't think about anything, what is happening in your life, why this is happening, whatever happened. All your past, future has to be left at that moment, be in the present situation. Whichever question will be, I will give my 100% to answer that question. That is enough. You need that much only. Okay? And the result will be in your favor. First to grow or build produce. First to grow or first to come. So IgM will be one. And most abundant is IgG. Please remember, most abundant is IgG and the first to come is Ig. Next, test organism used for bioassay of vitamin B12, Escherichia coli 113D, E. coli 331D, Bacillus subtilis 113P, and Bacillus subtilis 331P. If suppose, please understand, such kind of questions are appearing in your tomorrow's examination, don't get demotivated. If you don't know, left it out because there will be several questions which are not required to be answered. So don't be in hurry and don't be in worry to answer such questions. They are not there to be answered by you people. Please understand this. So option A is correct answer here. You can simply left such kind of question. This question are there just to fill the pages and not for you people to answer them because they are just not deciding your rank. They are just there. Simple. Understand this. Immunoglobulin find in lymphocyte surface of newborn. In newborn, IgD, IgA, IgM, and IgG. Option A, IgD will be found on the newborn surface. Yes. Dash participate in replication of mitochondrial DNA, DNA polymerase alpha, DNA polymerase beta, DNA polymerase gamma, and DNA polymerase delta. Again, if you don't know such kind of question, they are just there to fill up the pages, not there to make you this question fill up the pages and to make you worry. If you are worried individual or if you are very anxious soul which is sitting in the paper, then you people will try to identify which will be the correct answer, which will be the correct answer. But if you don't know, simply skip it in the first round itself. Don't try to use much of your brain on such questions where you are not finding any kind of clue or hint. Simple. So here the option C is correct answer. DNA gamma is the only DNA polymerase that function in the replication and repair of the mitochondrial DNA in the eukaryotic cells. Domestic trade is also known as home trade international. See, domestic and international, odd man out, not odd man out, opposite. Opposite will not be the correct answer. Now in this case, you can take a chance based on your confidence level. Home trade, export trade, import. They are talking about domestic trade. Export and import is what? Export and import again deals with international trade. Import means to make, to give, to get the goods from outside the country. Export means to give the goods from our country to outside the country. So just by using our common sense, we are getting to know that this too will not be the answer. Automatically, you will get first as your correct answer. Last question. Which of the following diseases is not caused by microbial protein toxin? Botulism, diphtheria, Shigella dysentery, and tuberculosis. What do you think? Which will be the correct answer here? Which of the following diseases is not caused by microbial protein toxin? Option D is correct answer here. Tuberculosis. See, botulism, well, by the Clostridium botulinum. Shigella, again, Shigella dysentery caused by the periplasmic protein. Again, here the protein is involved. Corynebacterium diphtheria cause diphtheria. Okay, again, it is toxin. But Mycobacterium tuberculosis is a microorganism that causes TB, that we all know that. But here, there is no mitochondrial protein as microbial protein as such involved. Okay. Now the pharmacology and other subject will be taken up by the Devanshu sir. Till then, you people wanted to say something, want to ask anything for tomorrow's examination, ask right now. We have still some few minutes. Yes. Till then, I'm asking Devanshu sir whether he is ready. Any doubts, anybody? About examination, ma'am, I'm feeling like this. What should I do? I'm feeling like that. What should I do? Just chill. I'm telling you, just chill now. It's your time to chill. Anybody? Okay. So don't worry. Don't get panic at first moment. Don't get panicked. Everything will happen in your favor, and which is best for you. That will only be happening. Just always make sure that whatever question will be appearing on your screen, the question will be appearing. You need to answer that question itself. You don't have to think about the other question. Just think about the question which is appearing on the screen. Nothing else. Okay. Make sure you are following these guidelines and accordingly doing your best. Okay, then now I will hand over to Devanshu sir. He will take your pharmacology and then your non-pharma part will be taken by the Aditi. Understood? Take the question just as not as a revision, just as something is happening. I am getting to know the question. Just need to answer. That is enough. Thank you so much. Yes, there will be discussion. Definitely, there will be discussion. Okay, there will be discussion after your examination. Okay. Then all the very, 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 very best to you guys. Give your best and rest. Be detached right now. Get yourself detached from the result. Just give your best. This is the prime motive. You must wake up tomorrow with and give your examination with this motive only, that I will give my best in every question. In every question, I will give my best. That is it. Okay? Yes. So no, right now, not nothing as such like this, Satvik. So give your best and thank you so much. All the very best again. Best and
हेलो ठीक ठीक थैंक यू ओके Okay, so everyone, good afternoon and welcome back to GDC English classes, guys. Good afternoon. How are you all? Good afternoon, champions. Good afternoon. Am I audible and visible properly? Please confirm me first over here. Yeah. Am I audible and visible properly? Good afternoon, Ritax, Vikas Yadav. Good afternoon. Am I audible, visible properly? Please confirm me. Then we can start over here. NIPER JEE 2025, last year question paper, memory based question. है And fine. All right. All right. Yeah. All right, guys. Fine. Fine. Audible and visible. Fine. Thank you so much. Thank you. Thank you. Thank you. All right, guys. So here we have the pharmacology as well as pharmaceutical chemistry that we're going to solve over here. That came in NIPER JEE 2025, right? So, as you know, your examination is tomorrow, your heartbeat might be going bit up, you might be stressed, you might be thinking, sir, what going to be happen tomorrow? See, as Neelam ma'am said, everything is happening for a reason, right? So just trust the process, trust the timing, है definitely you will be having in a good state of mind tomorrow and you will have a good exam tomorrow as well. Okay, so make sure everything goes very much right to you tomorrow, right? You should be a very much having a positive kind of attitude towards the examination. Just go with a smile. You don't be panic. You should not need to be panic over there. Once you panic, then everything will be difficult for you now to adjust the things. So make sure you're going with a good approach, good attitude, with a smile on your face that yes, I will definitely able to crack this examination and get that seat into the NIPER examination, right? Right? Okay, guys, let's go ahead with the first question. Are we good to go? Just give me a thumbs up. Just give me a thumbs up so that we can start now. Yeah, just give me a thumbs up so that we can start. Thumbs up, thumbs up. Yeah. Chalo guys, let's go start with the first question over here for pharmacology, right? Okay, so bevakizumab is which type of inhibitor? Okay, bevakizumab is which type of inhibitor? Is it your tyrosine kinase inhibitor, VEGF inhibitor, protease inhibitor, or COX inhibitor, right? What's that? Bevakizumab is a type of which inhibitor? That is your obviously anti-cancer drug, which is considered to be as a targeted drug, right? Targeted drug, है ना? Targeted drug for a particular site, for a particular thing over here, right? So it is comes under tyrosine kinase, VEGF, protease, or COX inhibitor. COX inhibitor, तो obviously no. Tyrosine kinase, no. VEGF, yes. VEGF inhibitor, it is, right? Chalo, let's go ahead. Yes, VEGF inhibitor. This table is very much important, guys, over here. Here you can see BCR ABL tyrosine kinase inhibitor. In Hindi, we used to say Bekar Din, Bekar Din. The D for dilotinib, sorry, dasatinib, I for nilotinib, and N for, sorry, I for imatinib, and N for the nilotinib. The Bekar Din in Hindi, we used to say. So, Din you have to remember, okay, over here. EGF, Jeff. Just rewrite EGF in a different order of alphabetical order. Jefitinib, erlotinib, E for erlotinib, erlotinib, cetuximab. Over here, if I talk about this angiogenesis inhibitor, that is your bevakizumab, sunitinib, as well as sorafenib. Proteasome inhibitor, that is your bortezomib. That means protease peoples are very much boring, right? Protease peoples are very much boring. CD20 inhibitor, that's your rituximab. You have to remember over here. All right. Chalo. Next question. Next question. Entacapone and tolcapone are of which type of enzyme inhibitor? MAO inhibitor, COMT inhibitor, acetylcholinesterase inhibitor, or dopa decarboxylase inhibitor? What's that? Simple, right? Very simple question over here. Hana? These are the drugs which are being very much useful in your Parkinson disease, right? Parkinson disease. The MAO-B, COMT, acetylcholinesterase, or dopa decarboxylase inhibitor. What's that, guys? That is definitely your COMT inhibitor, right? COMT inhibitor, catechol O methyl transferase inhibitor, right? Catechol O methyl transferase inhibitor. Hana? Over here, if I talk about this MAO-B inhibitor, the MAO-B inhibitor, we do have what? Resegelin as well as selegelin. Resegelin as well as sorry guys, sorry. Okay. Resegelin and selegelin, MAO-B inhibitor. Okay. Acetylcholinesterase inhibitor, that's okay. Huh. All right. So here it is your COMT inhibitor. Dopa decarboxylase, dopa decarboxylase is nothing but benserazide, as well as carbidopa, है ना? Carbidopa. These are your dopa decarboxylase inhibitor. Okay. Chalo, let's go ahead. Okay, COMT inhibitor. Out of which they used to ask one more question over here. Out of which entacapone and tolcapone, which acts both centrally as well as peripherally. Yeah, which acts both centrally as well as peripherally. What they are going to have over here in between these two drugs, which are going to act centrally as well as peripherally. These are nothing but your tolcapone, centrally and peripherally. Okay, centrally and peripherally they're going to act. Two means two over here. Another two means two side, centrally as well as peripherally. All right, chalo, let's go ahead now. Let's go ahead. Okay, now which of the following drugs acts on the renin angiotensin aldosterone system? Okay, RAS system, guys. Simple. RAS system, renin angiotensin aldosterone system. Atenolol, okay, beta 1 blocker. Furosemide, loop diuretic, है ना? Enalapril, yes, ACE inhibitor, है ना? ACE inhibitor, right? Digoxin, that's cardiac glycoside. Digoxin is that is cardiac glycoside. ACE inhibitor are useful to inhibit the ACE enzyme. And what does it do? Angiotensin converting enzyme. So angiotensin 1 को convert करने के लिए we do have angiotensin 2 angiotensin converting enzyme, and this enzyme will be inhibited by the ACE inhibitor, है ना? Simple. So third का C is your correct answer. By the way, this atenolol beta blocker also acts on the RAS system indirectly. How? This beta blocker also going to inhibit the release of renin. Okay, make sure you remember, because beta 1 receptor is also present into the JG cells of kidney, and through JG cells of kidney renin is being released. So beta 1 blocker, that's your atenolol, is going to inhibit the release of renin from the JG cells. Okay, chalo. All right, enalapril. Phenaldopam is useful in the management of, okay guys, Phenaldopam, hypertensive emergencies, migraine prophylaxis, congestive heart failure, or tachyarrhythmia. What's that? Anyone? What's that, guys? That is nothing but your hypertensive emergencies. Mein phenaldopam is being used, right? Phenaldopam is your dopamine receptor agonist. Okay, chalo. Which of the following is your DPP4 inhibitor? DPP4 inhibitor, DPP4 inhibitor is very much useful in your diabetes mellitus, है ना? Very much useful in diabetes mellitus. Glibenclamide, sitagliptin, metformin, or a carbos. What's that over here? Glibenclamide is your G drug of sulfonyl ureas, right? G drugs of sulfonylurea. Yes. Sitagliptin, yes. Sitagliptin, vildagliptin, saxagliptin, these are your DPP-4 inhibitor. DPP-4 inhibitor, right? And what does DPP-4 enzyme do? DPP-4 is nothing but an enzyme, guys. This is an enzyme which is used to metabolize, the GLP-1. Metabolize GLP-1. So that's why this DPP-4 enzyme should be inhibited by a drug that is nothing but your sitagliptin, just to increase the level of glucagon-like peptide, है ना, over here. Okay, metformin, you know, AMPK activator, carbox alpha glucosidase inhibitor, that was came in your GPAT 2026, है ना. Okay, now what is the mechanism of action of 𝘂𝙑? Okay, imatinib, guys. Imatinib, I just told you, है ना. Imatinib, I just told you, that is your BCR-DIN, BCR-DIN, है ना, DIN, DIN. So D for dasatinib, I for imatinib, and N for nilotinib, right? These are the ones which are going to undergo the category of BCAR-ABL tyrosine kinase inhibitor C, right? C is going to be your correct answer. है ना? C, yes. I told you a trick, DIN. T dasatinib, I for imatinib, and N for nilotinib. Okay. Now, which of the following drug is commonly used to treat MRSA? Methicillin-resistant Staphylococcus aureus infection. Methicillin-resistant Staphylococcus aureus infection. MRSA, guys. MRSA में what do we use? Amoxicillin, vancomycin, ceftriaxone, or metronidazole? What's that? Yeah. Over here, this vancomycin are very much used for your MRSA, right? Methicillin-resistant Staphylococcus aureus. But what if I talk about this VRSA then? If I talk about VRSA then, vancomycin-resistant Staphylococcus aureus, then which drug is need to be given over here? In VRSA, guys? In VRSA, which drug needs to be taken over here? Vancomycin, red man syndrome, remember? Red man syndrome, है ना? VRSA में which drug is being used? Nobody. Nothing like linezolid. Linezolid is the drug which is acting onto the 23S subunit of ribosome. Okay, remember that, right? Chalo. Which of the following drugs acts as a RNA polymerase inhibitor? Okay, RNA polymerase inhibitor, guys. RNA polymerase inhibitor. RNA polymerase inhibitor. Exactly, Vikas Yadav, है ना? Very good, है ना? Okay, so RNA polymerase inhibitor. I told you a trick to remember. That is your nothing but Dr. Rifa, right? Dr. Rifa. What is Dr. Rifa? Dr. Rifa is nothing but DNA dependent RNA polymerase. है ना? Onto this enzyme, which drug is going to act? Rifa. Rifa means rifampicin, right? Rifampicin is the one which is acting onto the DNA dependent RNA polymerase. Rifampicin, we do have two more things. Orange urine, first of the things, you know, है ना? Orange urine, first thing. Second thing is that it also has flu-like symptom, guys. Flu-like symptom. Okay, so this is you have to remember. Flu-like syndrome or flu-like symptom, it may cause rifampicin, है ना? I have talked about RNA polymerase inhibitor, but what if RNA dependent RNA polymerase? RNA dependent RNA polymerase, guys. What if for this one? RNA dependent RNA polymerase? Anyone? Can anyone tell me that? DNA dependent RNA polymerase, I told you that is a rifampicin. But what is RNA dependent RNA polymerase inhibitor? RNA dependent RNA polymerase inhibitor, guys? Anyone? That is nothing but remdesivir. Remdesivir, है ना? Which was acting against the COVID-19 virus. COVID-19 virus. Okay? It's not rifabutin. Right? Chalo. Rifampicin. Now, which are the host cell membrane receptor that the outer coat protection GP1, glycoprotein 120 of glycoprotein binds to? Okay. glycopurin 120 of HIV binds to. All right. CD4 and CCR5, CD4 and CXCR5, CD8 and CXCR4, CD8 or CCR5. What's that, guys? Anyone? Yeah, that is your CD4 and CCR5, obviously, right? CCR5 inhibitor, Mara Virog. Hai CCR5 inhibitor, that's your Mara Virog. And that is only very much useful in your what? Antiretroviral drug. Sodium potassium pump follows which type of transport mechanism? Okay, sodium potassium pump, guys. Sodium potassium pump. Anyone? Sodium potassium pump. Sodium potassium pump. That has been useful in your cardiac myocell. Cardiac myocell. In which the glycosides going to act onto and going to inhibit that one. Is it a simple diffusion, facilitated diffusion, primary active transport, or secondary active transport? What's that? That is nothing but your primary active transport, right? Okay, now what is the primary cause of myasthenia gravis? Okay, primary cause of myasthenia gravis. What's that? Myasthenia gravis is nothing but your autoimmune disease in which neuromuscular junction receptor is going to be destroyed, right? Destroyed. So what is the correct option over here? Genetic mutation in muscle cells, bacterial infection of the nervous system? No. And autoimmune destruction of acetylcholine receptor? Yes, exactly. That is nothing but your NM receptor. NM receptor that has been destroyed. Okay, the C is going to be your correct answer. Sure. Yes. Now, which of the following is a biological product? Okay, biological product, guys. Beta-methasone, retinoic acid, cyanocobalamin, or paracetamol? Yeah. 𝙂𝙋𝘼𝙎𝙎𝙎𝙬𝙎, autoimmune disease. Yes. Sattvic creative universe. Yes, C, exactly. Over here, that is nothing but your cyanocobalamin, which is what? Vitamin B12. Vitamin B12. Okay, from the living organisms, derived from your living organism, that is composed to be your biological one. Okay. Levodopa, carbidopa. Levodopa, carbidopa, imapinum, metronidazole, clavulanic acid, cilastin, or sulbactam. Yeah. What's that, guys, over here? Levodopa, carbidopa, that is being useful in a combination, right? Combination, right? Now, tell me this one. Imipinum, pinum, that is your, obviously, what? Monobactams, So, imapinum, metronidazole, clavulanic acid, cilastatin, or sulbactam. What's that? What should be the correct answer over here? Imapinum is going to be having a combination with cilastatin, right? Cilastatin is the inhibitor of dihydropeptidase 4. Okay, chalo. Asthma is being treated with which one? Beta 1 agonist, beta 2 agonist, alpha agonist, or muscarinic antagonist? Simple. Bacha knows this question too. Bacha knows, guys. Everyone knows that asthma is treated with your beta 2 agonist, salbutamol, terbutaline, salmeterol, formoterol. Simple. Yeah. Chalo. Now, which hormone is commonly released during short-term stress? Okay. Short-term stress. The short-term stress pay, which hormone is being released? What's that? Is it insulin, adrenaline, glucagon, or estrogen? Guys, anyone? That is nothing but your adrenaline, okay? Because at the time of stress, you'll be having adrenaline rush in your veins, right? And the same adrenaline you have to produce tomorrow. Bit of stress, but that adrenaline will definitely able to kick your power into a positive set. Okay, positive set. Okay, now adrenaline over here. What is the correct term in the medical literature for mental retardation? Okay, guys, mental retardation. Mental retardation. Is it a mental deficiency, cognitive delay, intellectual disability, or mental impairment? What should be the correct answer over here? That is nothing but your intellectual disability. That means what? That means That means the person will not be able to think much, है ना? Mental retardation. The ability to use the mind is restricted now. That is your intellectual disability, right? Chalo. Mixed edema coma is a severe complication of which condition? Okay, mixed edema. Mixed edema. Mixed edema. है ना? Mixed edema. M for mixed edema. And when the T3 and T4 level, when T3 and T4 levels is decreased in men, and decreased in men. Okay, M for men and M for mixed edema. This is you have to remember. The same term is used to called as cretinism. है ना? Cretinism. Same term. T3 and T4 level. T3 and T4 level is reduced in children. C for children. C for cretinism. Okay. So this is what? Hyperthyroidism, hypothyroidism, Cushing syndrome, or Addison disease. Obviously, that would be your hypothyroidism. Hyperthyroidism means to be as Graves disease, right? Graves disease. Cushing syndrome, ACTH level is increased. Addison disease, ACTH level is going to be decreased. Okay, this is you have to remember, guys. All right. Okay. Now here you can see over here, goiter is also next variant because just because of the deficiency of iodine, है ना? Okay, which of the following is a common symptom of PCOD? Okay, PCOD, polycystic ovarian disease. Polycystic ovarian disease. Now it becomes PMOS. Now it becomes PMOS. Hmm. Polymetabolic ovarian syndrome, PMOS now, है ना? So what is heavy over here? Common symptom of PCOD: heavy menstrual bleeding, pain during evaluation, irregular menstrual cycle, or early menopause. Obviously, that would be your irregular menstrual cycle because your ovaries size is increased also, but the fallopian tube's diameter is very much going to be shrink right now, and at that case, so the egg doesn't even release at that time, है ना? So that's why irregular menstrual cycle takes place. Okay, irregular menstrual cycle takes place. Now, which of the following is a sex linked disorder? Huntington disease, hemophilia, cystic fibrosis, or thalassemia? What's that, guys? That is nothing but your hemophilia over here. This is your X-linked recessive disorder. Okay, sure. Factor 8 for hemophilia A and factor 9 for hemophilia B. Okay, remember this one. Now, most abundant protein in human is what? Collagen, hemoglobin, keratin, or myosin? Ha, guys. Anyone? Most abundant protein in humans? Most abundant protein in humans is nothing but your collagen that is present in your skin, hair, nails, collagen, right? Okay. Now, sodium chromoglycate is used as bronchodilator, mast cell stabilizer, antihistamine, or corticosteroid. What's that, guys? Anna, so sodium chromoglycate is nothing but your mast cell stabilizer, mast cell stabilizer. Not only sodium chromoglycate, also it includes catotiffin, है ना? Also it includes nadochromyl. Okay, so these two things are very much also involved in your mast cell stabilizer, and these are the drugs which are not weakly acidic, not weakly basic. These are strongly ionized drug, guys. These are strongly ionized drug, है ना? That means what happens? If they are strongly ionized in nature, they will not get absorbed because for absorption, weakly acidic or weakly basic thing is required. Here it is strongly ionic. So no absorption takes place. No absorption takes place and hence excrete in unchanged form. Excrete out in unchanged form. Okay. So this is you have to remember excrete out in unchanged form over here. All right. चलो Montelukast. Montelukast कहाँ से आ गया सात्विक? Montelukast is your leukotriene antagonist, leukotriene receptor antagonist. And with Montelukast, there is Zafirlukast as well. And there is a syndrome associated with Montelukast and Zafirlukast, that is your Churg-Strauss syndrome. Okay? Churg-Strauss syndrome. Right? Sure. Here you can see Montelukast and Zafirlukast, leukotriene antagonist. Mast cell stabilizer, sodium chromoglycate, nadochromyl as well as ketotifen. Okay. Montelukast acts on which of the following receptor to block the action of leukotrienes LTC4 and LTD4? Simple. Simple, guys. What's that? Cis, leukotriene 1, H2 receptor, CB2, or muscarinic. Obviously, that would be yours. Cis leukotriene receptor, and this may cause Churg-Strauss syndrome. Okay? Remember this. Churg-Strauss syndrome is associated with this one. Okay? Now, the first drug launched under the Kalakar Health Initiative. Hypothetical example is Calabantine, paracetamol, cough syrup, or diclofenac. The first drug launched under the Kalakar Initiative, Kalakar Health Initiative. Hypothetical example is what? Calabantine, as the name suggests only. As a name sound, fabricated and specifically designed to align with the Kalakar Initiative. Highly probable that a hypothetical initiative would launch a hypothetically named drug. Okay? Chalo. Ethambutol acts via inhibiting what? Protein synthesis, mycolic acid synthesis, cell wall, or DNA? Huh? Anyone? Ethambutol acts via which thing? Protein synthesis, mycolic acid synthesis, cell wall, or DNA? What's that over here? Hare Krishna Prajita. Yeah, over here. Ethambutol, E for ethambutol and E for eye toxicity. है E for eye toxicity, visual field disturbance, visual field disturbance that they have asked in your GPAT 2026, right? Protein synthesis, no. Protein synthesis, no. Mycolic acid, that is your INH. Cell wall, yes. Cell wall inhibitor, that is your ethambutol, right? Arabinosyl transferase inhibitor, exactly. Very nice, Murugan. Okay. Cell wall. Now, longest acting insulin is what, guys? Longest acting insulin, Glargine, Lispro, Detamir, or Aspart. These all, what? Longest acting they have asked, no? There are two longest acting over here. There are two longest acting over here. Yeah. Glargine as well as Detamir. These both are your longest acting, right? Longest acting. Where if I talk about this Aspart and Lispro, these are your shortest acting. Shortest acting. Okay. So make sure you remember this one, guys, over here. Glargine and Detamir both. Here you can see where it is one. Long acting Glargine as well as here you can see Detamir. Both ones. Okay. Chalo. Fine. Alzheimer disease caused by what? Beta amyloid, decreased dopamine, decreased acetylcholine, decreased dopamine. Cause what? अच्छा Alzheimer से क्या होता है? Okay. Obviously acetylcholine is going to be decreased down, but beta amyloid is the one thing which can cause Alzheimer disease. Okay, this is the remember thing. This is the pathophysiological thing. Beta amyloid is responsible for causing Alzheimer disease, beta amyloid plaques. Whereas acetylcholine level is going to be decreased down over here. Okay, chalo. Okay, fine. mTOR inhibitor set max. I told you. Remember? Set max. Set max. S for Everolimus, temsurolimus over here. So what's that? Sirolimus, yeah, Sirolimus, sorry, Sirolimus, cycloserine, tacrolimus, or anakinra. So Sirolimus is going to be your correct answer over here. Okay, Sirolimus, yes, mTOR inhibitor over here, है ना? चलो, Sirolimus, Everolimus, and Temsorolimus, that is your set max, है ना? Set max, M for mTOR and M for max, so set max, है ना? Set max is a channel. This is the way that you can learn all these things. Okay, digoxin poisoning. Digoxin poisoning, magnesium sulfate, protamine sulfate, flumazenil, or digoxin immune fab. Fab. What's that? Obviously, that is going to be your digoxin immune fab over here, right? Magnesium sulfate, protamine sulfate for heparin, है ना? Protamine sulfate for heparin, flumazenil for your benzodiazepine poisoning, है ना? Benzodiazepine poisoning, है ना? Digoxin poisoning, digoxin immune fab, that is your digoxin poisoning over here. Okay, digoxin poisoning over here. All right, chalo. All right, guys. Synergism. What is synergism? Enhancement of effect by effect of both drugs. Sum of effect of both drugs. Complete inhibition, no effect on another drug. What's that? Simple, very simple, right? That is nothing but enhancement of effect of both drug. That is your synergism, right? Chalo. Which of the following anti-cancer drug mechanism related to phase arrest? Okay, M phase arrest. All right, M phase arrest case. M phase arrest. है ना? Meta phase arrest. Meta phase arrest. Vincristine, cyclophosphamide, chlorambucil, or etiposide? Yeah, simple. Very simple over here. Vincristine, cyclophosphamide, chlorambucil, or etoposide? Obviously, if I talk about vincristine, है ना? Taxanes, or if I talk about podophylotoxin, these are acting against the M phase over here. M phase arrest, है ना? Mitotic spindle को they're going to inhibit, right? Cyclophosphamide. Plenty of things are here. Cyclophosphamide is drug of choice. Is drug of choice in lung cancer, है ना? Lung cancer, right? Mesna is the antidote for hemorrhagic cystitis that is being produced by cyclophosphamide. Chlorambucil is drug of choice. Drug of choice for, huh? What is that? Acute myeloid leukemia. Acute myeloid leukemia, right? This is you have to remember. Etoposide, that is your nothing but topoisomerase 1 inhibitor, है ना? Topoisomerase 1 inhibitor. That is you have to remember, guys, over here. Okay, microtubule damage, exactly. Aspirant pharma PDK, है ना? Okay, now symptoms of muscarinic poisoning. Okay, muscarinic poisoning, guys, over here. Yeah, muscarinic poisoning, if I talk about, the muscarinic is nothing but your choline, है ना? Acetylcholine. So acetylcholine, what will do? Tachycardia? No, that is your anticholinergic. Hypertension? Yeah, through M2 it can. Dry mouth, that is your anticholinergic. Constipation? Yeah, that is also anticholinergic. But this hypertension through M2 receptor, through M2 receptor, which is of GI in nature, right? GI in nature, that is going to act on your heart and reducing the conductivity of SA node. So obviously that would be your hypotension would be your correct answer. है ना? Hypotension. Exactly. Now, which is not obtained from animal? Which is not obtained from animal, guys? Over here, heparin, captopril, erythromycin, or primarin. Not obtained from animal. That is your captopril, which is your synthetic one, na? Fully synthetic. In which drug therapy there is a requirement of body surface area based dose adjustment? Which of the therapies, guys? Hmm? Which of the therapies require dose adjustment of body surface area? That is nothing but your chemotherapy only, है ना? That has been done on the basis of surface area, age, gender, right? All these things are over here required for your chemotherapy. Okay. Now, hormone released from zona glomerulosa. Okay. Zona glomerulosa. Yes. So these are the ones. Zona glomerulosa. Glomerulosa. Right? Zona fasciculata. Zona fasciculata. And zona reticularis. Zona reticularis. Fascicularis, right? Over here. So there are three zones. There are three zones under the cortex region, under the adrenal cortex region. Adrenal cortex region, right? So over here, zona glomerulosa, we do have what? We do have what, guys, over here? That is nothing but mineralocorticoid. Okay, mineralocorticoids are being released from your zona glomerulosa, which is nothing but your aldosterone, right? Zona fasciculata, glucocorticoids. Glucocorticoids. Okay, glucocorticoid. And in zona reticularis, that's your sex hormones, which has been released over here. Hai. So over here, if I talk about zona glomerulosa, they have asked. So aldosterone, mineralocorticoid, adrenaline, or dopamine. Obviously, these both are being released from that one. So that is your mineralocorticoid would be your correct answer in more appropriate way. Okay, zona glomerulosa A. Sorry. That is your B mineralocorticoid. Hai na? Here you can see F and G. Hai na? F and G is much nearer. G and M is also very much nearer. Over a reticularis, that is your sex hormones. Okay. Chalo. Next. Mineralocorticoid, aldosterone, these are the same things. Okay. Here you can see zona glomerulosa, aldosterone, mineralocorticoid over here. All right. Now, which of the following produced by biological system? Okay. Biological system, guys. What's that? Biological system. Toxin, toxicant, poison, or xenobiotics. What's that? That is nothing but your toxin over here, right? Toxin over here. Okay. Now, syphilis is caused by which microorganism? Syphilis is a sexually transmitted disease, है ना? Sexually transmitted disease, entamoeba histolytica, that is for amoebiasis, plasmodium falciparum, that is for malaria, trypanosomus pallidum, yes, trypanosomus pallidum, that is your nothing but, what's that? Syphilis, right? Syphilis. And what if the penicillin is injected into the syphilitic patients? What if the penicillin is going to inject into the syphilitic patients? And what's going to be happen, guys? Can you guys tell me over here? When penicillin is going to inject into the syphilitic patients, then what's going to be happen? Trypanosoma pallidum is your correct answer over here. But what's that? I'm asking. Anti-asthmatic achieved by obviously beta 2 agonism, right? Okay. What neurotransmitter is formed by what? Formed by what? Phenylalanine, tyrosine, or what? Phenylalanine or tyrosine or what? What's that? Dopamine they have asked, no? Okay. Adrenergic system is related to the obviously, but the phenylalanine, obviously that's your dopamine. Okay. Sure. 𝙂𝙋𝘼𝙎 reaction, exactly, spiroketal product. Okay, very nice. Ritax and Sai Krishna, very nice, very nice. Okay, where primary absorption of drug occur? Primary absorption, stomach, small intestine, large intestine, or liver? Obviously, that's your small intestine, because small intestine may you have increased surface area, right? Increased surface area, है ना? And increased surface area due to microvilli, है ना? Due to microvilli. Okay. So due to the microvilli presence over here, this one you can say like surface area of small intestine is going to be increased, right? Okay. Now, which is prodrug and converted to nitric oxide? Okay, which is prodrug and converted to nitric oxide? All right, guys. Over here, nitroglycerin, amyl nitrate, pentaerythritol nitrate, or all of the above. What's that? That is nothing but all of the above, which is going to increase the level of nitric oxide into the blood. So vasodilation takes place, right? Okay. What is megaloblastic anemia? What is megaloblastic anemia? That is just due to the deficiency of vitamin B12. Exactly. Caused by iron deficiency? No. Hana? Caused by destruction of red blood cells? No. Caused by deficiency of vitamin B12? Yes. C is going to be your correct answer. Hana? C is your correct answer over here. Right? Now. Father of chemotherapy, Paul Ehrlich, Hippocrates, Galen, or Ramnath Chopra. Father of chemotherapy, that is nothing but your Paul Ehrlich, also known to be as your bullet magic, right? Bullet magic. Hippocrates, father of medicine. Father of medicine. Galen, first pharmacist. Galen, first pharmacist. Ramnath Chopra. Chopra, father of Indian pharmacology. Father of Indian pharmacology. Okay. नहीं रे. Father of Indian pharmacology. Indian pharmacology, what's that? Eh? Indian pharmacy. नहीं. Father of, I don't know. I got confused. Yeah, exactly. Father of Indian pharmacology, obviously. Father of Indian pharmacology. Yes. Okay. In 2024, which drug was launched as the country's first endogenous macrolide antibiotic? Okay, indigenous macrolide antibiotic. What's that? Nalithromycin, Darithromycin, Indrithromycin, or Hamycin? Yeah, that is your Nafithromycin. India launched nafithromycin, marketed under the brand name of Mignav, as its first indigenous macrolide antibiotic. Okay, chalo. Which of the following HMG coenzyme A reductase inhibitor is a prodrug? They are asking. Okay, prodrug they are asking. So prodrug, is it your atorvastatin, serivastatin, simvastatin, or pravastatin? What's that? Atorvastatin, serivastatin, simvastatin, or pravastatin? Prodrug, HMG coenzyme reductase. These are your statins drugs which are going to reduce down the cholesterol level, right? These are going to decrease down the cholesterol level. You can say LDL levels, है ना? LDL levels. What is the adverse drug reaction of HMG coenzyme reductase, guys? Adverse drug reaction, that is your nothing but rhabdomyolysis. Rhabdomyolysis, which is in common term we can say muscle pain. Okay, muscle pain, है ना? What is the correct answer over here? That is your simvastatin, exactly, Satvik. Very nice. Okay. The active ingredient of Ozempic. Okay, Ozempic, guys, Ozempic. Insulin liraglutide, insulin lispro, or semaglutide. Yeah. Anyone? Rhabdomyolysis, muscle pain. Exactly. Hmm. Over here, that is your semaglutide Ozempic. Okay. Chal. Which of the following drugs exhibit zero order kinetics at high or toxic dose? Okay. Zero order kinetics. Hmm. Oh, zero. Hmm. Warfarin, aspirin, alcohol, theophylline, and tolbutamide. P for phenytoin. Right? Phenytoin over here. So where does that paracetamol? No. Aspirin? Yes, aspirin. Amoxicillin? No. Metformin? No. है ना? Paracetamol hepatotoxicity, aspirin Ray's syndrome, also hepatotoxicity, amoxicillin Jarisch-Hexmeyer reaction, metformin, M for metformin, M for megaloblastic anemia. Its congener fenformin banned due to lactic acidosis, right? Aspirin. All right. How much drug remains in the body after 4 half-life have elapsed? Okay, 4 half-life elapsed they have asked, है ना? So remains in the body. Okay, remained. That means left, है ना? Left. So after first half life 50% would be left. After second half life 25% would be left, है ना? After third half life 12.5% would be left, and after fourth half life 6.25% would be left over here, right? So over here, if I talk about, then 6.25, okay. And in the complementary basis, that is nothing but 93.675, 93.675.5% would be out of the body, right? Out of the body will be gone, है ना? So 6.25, exactly. Very nice, guys. All right, chalo. Let's go ahead. The human ether 𝙂𝙂𝙎𝙎 HERG gene codes for what? Codes for what? Potassium ion channel, chloride ion channel, sodium ion channel, or acetylcholine channel. Very good. Shivani Anand and Sai Krishna. Very good. Okay. Over here, that is your potassium ion channel, right? Okay. Which of the following drug is classified as ACE inhibitor, guys? ACE inhibitor. Yeah. ACE inhibitor, you know. Losartan? No. Losartan, telmisartan, candesartan, these are your angiotensin receptor blocker. Right? Enalapril? Yes. Enalapril is the one which is your ACE inhibitor. Spironolactone? Aldosterone antagonist, potassium sparing diuretic. Amlodipine is the one which is your calcium channel block. Simple. So enalapril is going to be your correct answer. Dry cough, angioedema, these are the two ones. Two adverse effect that is associated with ACE inhibitor. Angioedema, dry cough. Okay. Chalo. Majority of the drug major passes through passive diffusion, active transport, pinocytosis, or passive diffusion. Obviously that would be your passive diffusion. Passive diffusion follows non-equilibrium kinetics, that is your first order kinetics, and 90% of the drug follows this one, passive diffusion. Okay. Chalo. What does 3 in CYP3A4 denotes? Family, gene number, or allele? Yeah, CYP3A4. 3 for family, A for gene, and 4 for gene number. Okay, so this is you have to remember over here. This is you have to remember family, gene number, allele. That is your family would be your correct answer. Okay. All right. All right, guys. So here we have now again pharmaceutical chemistry and allied subject 50 MCQs for you. Now pharmacology is done. I hope I have made you clear around all the questions regarding pharmacology. If you have found easy to understand and you have found good explanation, just give me a thumbs up and do like this video. Yeah, do like this video, guys, because right now only 8. Right now only 8. Only okay 12. Okay 12. Only 12 likes are over here. How was the explanation, guys? How was the explanation? Then we can start this one, pharmaceutical chemistry. Make sure to like this video, guys. 13 only likes. Yeah, Radhakrishnan, you can, right? You can. If you get above 60, then definitely you can have a good rank over there. Okay? Chal. Now pharmaceutical chemistry. The 4F orbital belongs to which block in the periodic table? Okay. SPDF 4F orbital. Okay. S, no. P, 3P, no. 4D, yes. 4DF and 4F. D block we do have over here, that is your 4F orbital belongs to which class? That's your D block as well as F block also, right? F block also. Okay, now the Wolff-Kishner reaction is used for Wolff-Kishner reaction. Wolff-Kishner oxidation of alcohol to ketones, reduction of alkenes to alkanes. No. And a conversion of aldehyde and ketones to alkanes. Yes. C is your correct answer over here. And a Wolff-Kishner reaction, or you can say there is another one. There is another one, guys. Wolff-Kishner as well as there is another one reaction which used to do this same thing. This same thing. What's that? What's that? What is that reaction? Wolff-Kishner reaction as well as? Which reaction? Tell me. Which of the following combined does not give a positive tolerance test? Okay, positive tolerance test. Tolerance test. Ethanol, methanol, ethanol, or glucose. For tolerance test, we have to have clemention. Exactly, Radhakrishnan. Exactly. Yes, Sai Krishna. Very good. Okay. Clemention reaction. Okay. Over here, that is going to be your ethanol, which is does not give a positive tolerance test. The tolerance test used to detect the presence of aldehyde and some other reducing compounds like alpha hydroxy ketone. It involves the oxidation of aldehyde to carboxylic acid and the reduction of silver ions into the tolerance reagent to metallic silver, which forms a silver Miller test over here. Okay. Chalo. Now, which of the following correctly represents the order of basicity from most to least among the given nitrogen containing heterocycles? What's the correct option over here, guys? Pyridine, imidazole, pyrrole, imidazole, pyridine, pyrrole, pyrrole, pyrimidine, imidazole, pyrrole, or pyridine. What's that? Huh? Anyone? That is your pyridine, imidazole, as well as pyrrole. Because in pyridine, you will be saying you'll be having lone pair as a free basis, है that is not participating onto the conjugation, है if you can see over here. What's that? Okay, they have not written. Pyridine, imidazole, as well as your pyrrole. In pyrrole, you'll be having those lone pair, but that lone pair is participating into the conjugation. So they have less basicity, right? Less basicity over here, okay? Okay, now, which amino acid does not occur naturally? Which does not occur naturally over here, guys? Histidine, phenylephrine, arginine, or aspartic acid? Obviously, it's your phenylephrine. Phenylephrine is not amino acid. That's a drug. Phenylalanine is your amino acid, right? Phenylephrine is your alpha 1 agonist. Okay, which of the following compound is most basic? Acetic acid, phenol, paranitrophenol, or nitrophenol? What's that? Anyone? Which of the following compounds is most basic? Acetic acid, phenol, nitrophenol, paranitrophenol, or O-nitrophenol? That is your phenol over here. Here you can see phenol is an aromatic alcohol with pKa of around 10. It is less acetic acid than but more acidic than nitrophenols. Okay, chalo. Which among the following compound will form a white precipitate with AgNO3 due to the formation of silver halide? Okay, guys, silver halide, AgNO3 will be forming a formation of silver halide over here. So what's that? NaCl, NaOH, Na2CO3, or CS3CONa? Anyone? That is nothing but your NaCl, obviously. Over here, NaCl plus AgNO3, AgCl plus NaNO3, and this is going to be give you a white precipitate. Okay. Now, the rate of aldol condensation depends on concentration of base only, concentration of aldehyde or ketone, both base and aldehyde ketone independent of any concentration. Aldol condensation, that is dependent on both base and aldehyde ketone concentration over here. Okay. Chalo. Which of the following is the correct IUPAC of para-nitrobenzaldehyde? Okay. Para-nitrobenzaldehyde, guys, over here. Para-nitrobenzaldehyde, that is your 4-nitrobenzaldehyde. Okay. P. What is the correct IUPAC name for para-methoxybenzaldehyde? Para-methoxy, obviously that is going to be your 4-methoxy then. Simple 4-methoxy, right? Okay. Combustion of natural gas is which type of reaction? Combustion of natural gas. So what? Combustion of natural gas over here, is it your exothermic, endothermic? Obviously that's going to be your exothermic because the heat is going to be released. If heat is going to be given, that is would be your endothermic, but if heat is released, then is your exothermic, right? Shall. Which metal is present in your vitamin B12? Okay, vitamin B12 cyanocobalamin, vitamin B12, it is your cyanocobalamin, cyanocobalamin. So what's that? Is it your iron, magnesium, cobalt, or zinc? What's that? Obviously that would be your cobalt over here, Cobalt would be your correct answer, right? Sure. Now, which of the following contains a pyridine ring? Pyridine ring, guys. Pyridine ring. Good evening, Shravani. All right. Is it your paracetamol, isoniazid, aspirin, or ibuprofen? Pyridine. That is your isoniazid, guys, over here. Okay. Isoniazid. Okay. Chala. Remember this one. Now, according to the n+1 rule, 3,3-dibromoethane will show which type of splitting in NMR? Singlet, doublet, triplet, or quartet? Yeah. 3,3-dibromoethane will show which kind of the splitting in NMR over here. That is nothing but your singlet one. How you can see over here? Only hydrogen are not there, है ना? So bromine is also over here. The bromine is the one which can be identify over here. So bromine will be having only one. Which of the following does not give the iodoform test? Okay, iodoform test: ethanol, acetone, isopropanol, or methanol. What's that? Yeah, guys. Ethanol, acetone, isopropanol, or methanol. That is your methanol over here. Okay, methanol. The iodoform test used to identify the compound that having a methyl ketone group or ethanol and secondary alcohol that can be oxidized to methyl ketones, methyl ketones. Okay. Now this one. What is the IUPAC name of the compound with structure Br2C, मतलब 3 carbons and 4? Okay, over here. Then what is the name of it over here, guys? 1, 2, 3, 4, है ना? 1, 2. The 1 dibromo, because 2 bromine are there now. So 1 dibromo 2 butane. Obviously, B is going to be your correct answer, है ना? B, yes, B is going to be your correct answer. Now, 2-methyl propene plus HBr gives what? 2-methyl propene, HBr, isobutyl bromide, tert butyl bromide, secondary butyl bromide, or quaternary butyl bromide. So over here, if I talk about propene, so propene C 2-methyl, no? So 2-methyl CH3 over here. Okay, so CH2, 1, 2, 3, 4, and CH3, right? So 2-methyl propene plus HBr will give you what? Hana? If H will be going which side? H will be going which side, guys? Double bond over here, no? So which side? Over here, and Br is going to be over there. Then this is going to be a tert butyl bromide, because there will be no over here hydrogen takes place, right? So tert butyl bromide. Which of the following cause red shift, guys? Red shift: methyl hydroxy amine or ethylene group. What's that? That is your amine group over here, right? So name the following structure. What's the structure over here? ER hep 3 into all, ZS hep 3 T hep 3 into all, hep 3 into all, or hep 3 into all ES wala. What's that? Following structure over here. That is your ES hep 3 into all. Okay. Now, which is not a detector in gas chromatography? Okay, gas chromatography. Flame ionization detector, ECD, TCD, array diode detector. Gas chromatography. That is your array diode detector. Okay. Shall. Beer-Lambert's law is useful in Beer-Lambert's law are useful for your UV visible spectroscopy, Hana, in which your it is directly proportional to the path length as well as concentration, right? The UV visible spectroscopy is your correct answer. Beer-Lambert's law, absorbance. Okay, in aldone condensation with acetophenone, order of reactivity for benzaldehyde, p-methoxybenzaldehyde, p-nitrobenzaldehyde, or formaldehyde. What will be the order of reactivity over here? The order of reactivity is your formaldehyde, benzaldehyde, p-methoxybenzaldehyde, and nitrobenzaldehyde. Which group will show shift in or is absorbance towards longer wavelength? Okay, longer wavelength. NHCOCH3, carbonyl group, ketone group, chloride group, all of the above. Yeah, over here that is your NHCOCH3. Okay, chalo. Which is the method to determine enantiotropic excess? Okay, enantiotropic excess: UV spectroscopy, IR spectroscopy, NMR spectroscopy, or polarimetry? Enantiometric excess, guys. Enantiometric excess, that is your polarimetry over here. Okay, chalo. Which of the following is an anti-aromatic in nature? Anti-aromatic. So anti-aromatic, 4n plus 2 is equals to pi electrons. है ना? Pi electron, that is what Huckel's rules. Huckel's rules fall for your aromaticity. है ना? Over here, if I talk about, so 2 electron over here, 2 electron over here. है ना? तो 4 इलेक्ट्रॉन, तो 4n plus 2 is equals to 4 electrons, right? तो 4n is equal to 2, n is equal to 1 by 2. This is your anti aromatic, है ना? This is your anti aromatic for sure, but this is not having conjugation. This is your non aromatic, right? Non aromatic over here. This one, this is your aromatic for sure. This is your aromatic for sure because conjugation is present, है ना? Conjugation is present. 2 electron here, 2 electron over here, and 2 electron over here. So 4n plus 2 is equals to 6, है ना? 6. So 4n plus 2 is equals to 4, and n is equals to 1. This will be your aromatic in nature, है ना? Over here, if I talk about, so 2 electrons. 2 electrons, that is also your 1 over here. The correct answer would be A, anti-aromatic, right? Now, the pinacol-pinacolone rearrangement is a method for converting what? 1,2-diol, 1,1-diol, 1,3-diol, or 1,4-diol. Huh, guys? What's that? That is your 1,2-diol, okay? Chalo. Albinism is associated with which amino acid? Albinism, guys. Tyrosine, phenylalanine, tryptophan, or histidine? What's that? Albinism. Hmm? Albinism is your tyrosine. Okay. The sulfur containing amino acid, sulfur containing amino acid, methionine, phenylalanine, tryptophan, or histidine. Methionine as well as cysteine, you can say. These both are responsible for your sulfur containing amino acid. These both are having the sulfur containing amino acid. Phenylalanine and tryptophan, these are your aromatic amino acid, right? Aromatic amino acid, है ना? Okay. Methionine and cysteine. Okay. Now, alkyl halide is transferred to alkane by dry ether, by which reaction? Wood's reaction? Obviously, yes. Wood's reaction is your correct answer. Alkyl halide RCl, for example, plus RCl, we having Na, है ना? तो 2Na plus Cl Na, है ना? Over here in the presence of dry ether, so this Cl and this Cl came with NaCl, and R and R over here binds to R and R over here, plus 2 molecules of NaCl will be removed off, है ना? So this Wood's reaction is your correct answer over here, right? Wood's reaction. Now, in which surface interface is not possible? Okay, gas liquid, or solid liquid? Obviously that would be your gas, in which surface interface will not be possible, है ना? So gas would be your correct answer. Now, which of the following amino acid contain achiral carbon? Okay, achiral carbon, and achiral carbon is responsible for the optical inactivity, right? Optical inactivity, and optically inactive. Optical inactive, is it a glycine, leucine, alanine, or methionine? Obviously, that would be your glycine over here, which is your optical inactive, है ना? Optically inactive. Chalo. Now, nucleosides are composed of two sides, pyrimidine base pair, pentose sugar, phosphate group, nitrogenous base plus pentose sugar. What's that over here? That is nothing but D, nitrogenous base plus pentose sugar, है ना? Now, the enzyme that converts pyruvate to acetyl CoA is called as what? Pyruvate A, pyruvate to acetyl coenzyme A is called as succinate dehydrogenase, isocitrate dehydrogenase, lactate pyruvate dehydrogenase. What's that, guys, over here? Yeah, anyone? That is nothing but your pyruvate dehydrogenase, है ना? Pyruvate dehydrogenase. Okay. Lecithin contains which of the following polar groups? Carboxyl group, amino group, phosphate group, or hydroxyl group? Lecithin is your one of a kind of surfactant, right? That is a one of a kind of surfactant. Carboxyl, amino, phosphate, or hydroxyl? That is your phosphate group that is present in your lecithin over here. Okay. Now, wetting reaction in dental materials refers to wetting reaction. What's that? Wetting reaction, chemical setting, of materials, the ability of a liquid to spread over a surface, hardening of composite resins, thermal expansion of materials. What's that? That is nothing but the ability of a liquid to spread over a surface. B is going to be your correct answer, right? Okay. Which is final electron acceptor in electron transport chain? Okay. Oxidative distress. Oxidative phosphorylation. What's going to be takes place in electron transport chain? Oxygen, ATP, cytochrome, or FAD? What's that, guys? That is nothing but oxygen over here. Okay. Chalo. Protein responsible for maintaining osmotic pressure in the body. Heparin, albumin, globulin, or fibrinogen? Yeah. Which one is the most abundant? Which one is most abundant? That is obviously your albumin. Hai, right? And albumin is the only one which is responsible for maintaining osmotic pressure in the body, right? Albumin. Okay. Now, megaloblastic anemia is caused by the deficiency of megaloblastic A, B12, D, or K. Obviously, that would be your vitamin B12, right? Vitamin A may cause your vision loss. That is your retinol acid, retinoic acid, right? Retinol, retinoic acid. Vitamin D, cholecalciferol can cause you rickettsia, bone deformation. Vitamin K, bleeding disorders, right? Chalo. Okay, which metal is present in vitamin B12? Obviously, we have understood vitamin B12 is nothing but your cyanocobalamin. Cyanocobalamin will be having your cobalt over here, Okay. Now, which is the most abundant protein in the body? Again, we have understood that is nothing but collagen only, Collagen only, right? Which is present under the skin, bones, and tendons. Caffeine and theophylline cause CNS stimulation by, okay, caffeine, chai, tea, coffee. So how does it causes the CNS stimulant? Acting under the adenosine receptor antagonist, NMDA, GABA receptor agonist, or acetylcholinesterase inhibitor? What's that? That is through adenosine receptor antagonist. Okay. So, which is aromatic? Hmm. Which is aromatic in nature? Cyclopropane. Cyclopropane is nothing but like this simple triangle. Cyclobutadiene. 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 Okay. It would be like this over here. Pyridine. Yes, pyridine. Sorry. This, and this over here. This is not. Wait, yeah. This is your pyridine and cyclooctatetraene. Cyclooctatetraene, obviously, that is your pyridine over here, which is your aromatic in nature. C is the one, okay? Not D, anything else. That is pyridine. Okay, now electrophilic substitution in pyrrole occurs mainly at which position? Pyrrole, guys. Pyrrole, 5-membered nitrogen ring. 5-membered nitrogen ring over here. So is it your 1 position, 2 position, 3rd position, or 4th position? What's that? That is your 2nd position over here. Okay. Chalo. Pinacol rearrangement converts what? Diol, carbonyl compound, ketone, alcohol, amide, amine, aldehyde, or acid. Pinacol rearrangement. Pinacol rearrangement, diol to carbonyl compound, as the name suggests only over here. Now, singlet carbene contains what? Singlet carbene. Singlet carbene. Two paired electron, two unpaired electron, positive charge and negative charge. That is your two paired electron over here, singlet carbene. Okay. Which acid is strongest? Which acid is strongest? CCl3, which is having minus I effect over here. Cl3 chloride fluoride group having minus I effect, and greater the I minus I group, greater will be the acidity. So D would be your correct answer, right? Okay. Now 1,3-butadiene reacts with ethylene to form what? Okay, 1,3-butadiene. 1,3-butadiene. So 1,3-butadiene, C, and C. 1,3-butadiene, है ना? The 1,3-butadiene CH2, H2, and H only यहाँ पे ना, H only and H2 over here. Plus ethylene, so CH2, double bond CH2. What is going to be takes place? This will be going at this side, है and this will be going at this side. So what will happen? Cyclohexane will be taking place. B is going to be your taking place. 𝙈𝙂𝙎𝙎. Exactly. 𝙈𝙂𝙎𝙎 is the one. Cyclohexene, sorry. Cyclohexene is going to be taking place. Yeah. Silver mirror test is for aldehydes, thioalcohol, amines, or ethers. What's that, guys, over here? Silver mirror is a test for aldehydes, right? Okay. How many isomer are there for C6H4, C6H14? C6H14 is nothing but hexane, and number of isomer, that is nothing but your 5 over here, right? The given structure are related to as. Okay. The given structure of here. Is it your enantiomer, mesomer, diastereomer, or racemic mixture? What's that? That is definitely not to be a racemic mixture over here, but this is your diastereomer. Okay. Chalo. Adsorption indicator are useful in, obviously, that is your Fajan method. है ना? Fajan method में they are being very much useful. Okay. Alright, guys, this is all about the pharmacology as well as pharmaceutical chemistry that we have for you guys from NIPER JEE 2025. है ना? MCQ session, that's your memory based question. Now it will be over to Aditi ma'am, who will be taking your non-pharma from here. Okay, thank you so much and wishing you all the very best for your tomorrow NIPER JEE examination. Don't take any stress. है ना, guys? Just trust your preparation, whatever you have done, and just go freely over there. And I'm telling you, we all GDC team is really proud of you, whatever you have done as a hard work, sacrifices, or whatever it is, sleepless nights, tensions, that will definitely going to make a smile on your face tomorrow for sure. Okay, so make sure you are worth it. You have done a lot and you are deserved to be a Niperian. Okay, tomorrow. With these words, thank you so much, and we'll see you the next day tomorrow with memory based questions of 2026 NIPER JEE examination tomorrow only. Okay, so thank you so much, guys. Bye bye.
Good afternoon, everyone. So let's start our non-pharma portion. Okay, so in this portion, we will trying to cover all type of questions. So let's start. Which team topped the medal tally in 38th National Games 2025? So we have to give the answer like which team topped the medal tally in the 38th National Games 2025. So you have four options, that is Maharashtra, Haryana, Services, Kerala. So what is the right answer for this question? Which team topped the medal tally in the 38th National Games 2025? Maharashtra, Haryana, Services, Kerala. The correct option is Services, that is option number C. That is option number C. So 38 national games conclude at the International Sports Stadium in 𝘿𝙄𝙎𝙎𝙎𝙎 on February 14, 2025. Okay, the services team topped the medal tally with 68 gold and 26 silver and 27 bronze medals. So we have to find the odd one. We have four options, that is retina, pupil, vision, cornea. So you have to find the odd one. Which one is odd one from the given four options? Retina, pupil, vision, cornea. You can see that retina, pupil and cornea are the part of eyes. All are part of eyes, but vision is different. Vision is different. So which one is odd one? That is vision. Option number C is correct. Option number C is correct. So retina, pupil, all are like part of eyes, while vision is the ability to see. That's why vision is different from other three options. What come next in the series? We have to find what come in the next from the series, like YVSP. YVSP. Okay, that is YVSP. You have to find the correct answer. So if you see that PQRSTUV, okay, WXY, WXY. So there is a gap of 2 letters, UTRU. So from there, what is the correct answer? That is MNO, then P. So correct answer is what? That is A. Option number A is correct. Option number A is correct. Okay. Now move to the next question, that is question number 164. In question number 164, we have to find the odd one. Okay. So we have to find the odd one. We have 4 numbers, that is 25, 36, 48 and 16. Okay. 25, 36, 48, 16. If you see, square of 5 is equals to what? That is 25. Square of 6 is equals to whom? That is 36. And square of 4 is equals to whom? That is 16. So the answer is what? That is 48. So which one is odd one? That is 48. So the answer is what? That is 48. Option number C is correct. Now the next question is choose the correct spelling. We have to choose the correct spelling for surveillance. Okay. So you have 4 options. If you see which spelling is correct, you have to find. Anyone? SURVEILANC, SURVILANC, SURVEILLANC. So as you know, option number C is correct. Surveillance. SURVEILLANCE. Now we have also choose the correct spelling in question number 166. If you see occasion, you have to choose the correct spelling for occasion. Okay, occasion. So correct spelling is what? That is option number B. OCCA, OCCASION is the correct spelling. Okay. Now the next is choose the correct synonym of the word August. For August, we have choose the correct synonym. We have 4 options, that is ordinary, humble, majestic, common. So August is what? That is majestic. So synonym of August is majestic. So August means grand, dignified, noble or majestic. So closest synonym is what? That is majestic. Now we have to choose the correct synonym for exaggerate. We have to correct the correct synonym for exaggerate. Okay. So exaggerate is to make something like seem larger. Okay. To make something larger, better. Okay. So in this kind, if you see minimize, okay, understate, amplify, reduce. So you have to choose the synonym. So synonym is what? That is amplify. So meaning of amplify is similar that exaggerate, like means to overrate or amplify something beyond the truth or reality. Okay. So correct is amplify. A person who studies birds is called. Whom we said who studies a bird is said to be what? Entomologist, ornithologist, herpetologist, ichthyologist. What is? So if you see entomologist is the when someone is studying about the insects and their relation with the humans. Okay, insects, study of insect, we can say that study of insect is said to be entomologist. Okay, entomologist. If you see herpetologist is a study of amphibians like frog, turtle. Okay, study of amphibians. Amphibians. Ichthyologist is the study of fishes. So the study of bird is said to be ornithologist. Ornithologist. That is option number B is correct. Option number B is correct. Yes, very good. Option number B is correct. Okay, now move to the next question. That is question number 170. So the study of earth is called, as all you know, the study of earth is called what? That is geology. That is geology. Okay. So study of earth is said to be what? That is geology. Next is least number subtracted from 9999 so that it completely divide by 19, so that it completely divided by 19. So how to solve this question? So in this type of question you have to divide the given number by the numbers that divide completely. Okay, so you, when you divide 9 by 19, you get what? That is some remainder and there's some question. So what you get? That is you get 5 to 6 and something reminder like 2 6, like something you get a reminder. Okay, but in this question reminder doesn't matter, matter is what? That is this. So when you multiply this number by 19, you will get what? That is 994. That is 9994. So 994 is the number which is completely divisible by 19, which is completely divisible 19, but we have to find least number, that what least number we have to subtract from this number to get this number. So how much you get? That is 5. If you subtract 5 from that number, you will get what? That is 999, which 9994, which is completely divisible by whom? That is 19. So option number A is correct. Yes, very good. Option number A is correct. Now move to the next question, that is question number 172. So we have to fill the blank. Okay, so modern technologies should at least dash new technology with of in was, with of in was. Anyone, what is the answer? Modern technologies should at least dash new technology, was in of, that is with, at least with new technologies, at least with new technologies. So option number A is correct. Option number A is correct. That is modern technologies should technologies should at least with new technologies. Okay, now let's move to the next question, that is question number 173. So find out that word, the spelling of which is wrong. So we have to choose the word from the given options that spelling is wrong. So penance, the meaning of penance is what? That is sorry for something. Penance, like sorry for something, is said to be penance. Okay, second, menace is what? That is threatening or danger, something that is threatened or danger. Okay, so which spelling is incorrect? That is tendency, that is TENDE, not A, E and CY, tendency. So the spelling of tendency is wrong. So option number C is correct. Okay, now choose the phrase from the opposite given below to replace the phrase printed in the bold to make the sentence grammatically correct. Okay, so the man to who I sold my house was a cheat. The man to who I sold my house was a cheat. That is to whom I sell, to who I sell, who was sold to whom I sold. What is the correct answer? What is the correct answer? The correct answer is what? That is whom. When we talking about something like the house is sold to someone, when we talking about something giving some reference, we use whom. So the man to whom I sell my house was a cheat. So option number A is correct. Option number A is correct. Okay, now choose the correct alternative for underlined word. All over Russia, Indian films are more popular than those in any other country. In, that of, those of. What is the correct one? What is the correct one? That is all over Russia, Indian films are more popular than those of in any other country. That is option number D is correct. Option number D is correct. Okay, now the next is find the angle. So we have to find the angle at 5 p.m. Okay, at 5 p.m. we have to choose the angle. Okay, so there is 6, there is 5, there is 12, 1 2 3 4 7 8 9 10 11. Okay, so there and there. So what angle? Here is 180 degree. Here is what? That is 180. If you see, there is what? That is 150 degree. Option number C is correct. Option number C is correct. We can calculate is by theoretically, we divide 360. So complete angle is whom? That is 360 degrees. So 360 divided by 12, that is 30. So now determine the numbers of step between the two hands, like there are 5 numbers. Okay, so 5 multiply 30, that is 150 degree angle. Now we have to complete this sequence, that is 2, 6, 18, 54. So if you see 2, 3 is 6. Okay, when you multiply 6 by 3, you will get what? That is 18. When you multiply 8 with 3, you will get what? That is 54. So when you multiply 54 by 3, you will get your answer. You will get your answer. Simple. So what? That is 3 4s are 12, 1, 3 5s are 15 or 16. So answer is what? That is 162. So option number C is correct. That is 162 is the correct answer. Now next question is G Summit 2024 held in. Where is G20 Summit held in 2024? Where? USA, India, Brazil, China. Where? In Brazil. In Brazil. So option number C is correct. Option number C is correct. First foreigner who got Bharat Ratan. First foreigner who got Bharat Ratan. C.V. Raman, Nelson Mandela, Abdul Ghaffar Khan, Mahatma Gandhi. So first foreigner is whom? That is Abdul Ghaffar Khan. Abdul Ghaffar Khan is was the first foreigner to receive the Bharat Ratan. He was awarded the honor in 1987. He was prominent Pashtuan leader and advocate for non-violent resistance against British. Okay, now Philistine in one word. Philistine in one word, we have to choose the correct. That is, they wear full dress and all, they drink alcohol, they lack culture refinement, they avoid social gathering. So Philistine is whom? Like a person who do not like understand or enjoy our beauty of arts, or we can say that culture. So the meaning is relatable. What meaning is relatable? That is they lack cultural refinement. So option number C is correct. Option number C is correct. They lack cultural refinement. A Philistine refers to a person who is indifferent or hostile to arts, culture and intercultural pursuits. Okay, next, 𝘂𝙗𝑠 is a, they wear full dress and all, they drink alcohol, men who oppress women, who avoid social gathering. So 𝘂𝙗𝑠, man who oppress women. Man who oppress women is said to be 𝘂𝙗𝑠. So oppress is to treat a group of person or a people in a cruel or unfairing way. Okay, so option number C is correct. Option number C is correct. Man who oppress women is who said to be 𝘂𝙗𝑠. Next is P has a son and a daughter. Okay, P has a son and a daughter. S is the mother of T. S is R's spouse. Q and R are children of P. Then how is Q related to S? We have to find. Good afternoon, Harendra. So option is what? That is Q is a sister of husband. Says the tree. Like R, like son of P, and Q is what? Daughter of P. So Q is sister of R. Okay. Now and R is the husband of S. So we can say that Q is the sister of husbands of S. Now there are statements like some cats are mouse. Okay. So there are some cats are mouse. Okay, some cows are cat. So there are some cows are cat. Okay, so we have to conclude. Okay, some cows are mouse. Some cow are mouse. No. Some cow are mouse. All cows being mouse is a possibility. All cows being mouse is a possibility. Which one is correct? According to me, only option B is correct. Like if only second conclusion follow, that is all cows being mouse is a possibility, maybe possible. all cows being mouse. So option number B is correct. Option number B is correct. Here is a complete explanation for the question. So cat, mouse, cows. Okay. So conclusion second, that all cows being mouse is possibility. Like mouse, cat, cows may be possible. Okay. So option number B is correct. Now what number should come next? We have to find, that is 8, 6, 9, 23, 87. Next number is what? Next number is what? That is, if you see, when you multiply 8 multiply 1, here we can do 8 multiply 1 minus 2, you will get what? That is 6. What you get? That is 6. Okay. When you multiply 6 by 2, that is 12, minus 3, you will get what? That is 9. Again, when you multiply 9 by 3, 3 9s are 27, minus 4, you will get what? That is 23. Again 23 multiply by 4 minus 5, you will get what? That is 87. Now 87 multiply by 5 minus 6, you will get your answer. You will get your answer, that is 429. That is 429. Option number D is correct. Option number D is correct. That is 429. That is 429. Okay. So option number D is correct. Next, in a certain language, nature, Nature, nature is coded as what? That is MASUQE. Okay, if you see E as it is, U as it is, and A as it is. So MN, so 1 backward, that is minus 1 backward. ST, 1 backward step, and QRS, 1 backward. Similarly, we can do for famine. FAMINE. So E as it is, I as it is, A as it is. Now E, F. Okay, so EA. So answer is what? That is EALIME. Option number D is correct. EALIME. Option number D is correct. That is LM, 1 step backward. Here is MN, 1 step backward. So option is D is correct. That is EALIME. Next question. ABC ratio ZYX proportion CBA. Now which one is correct? If you see opposite, A opposite is what? That is Z. B opposite what? That is Y. C opposite that X. So C opposite here is X. What is? That is X. So answer is what? From there we can see that the answer is what? That is only this having X, not that, not that, not that. So answer is what? X, Y, Z. Option number A is correct. Option number A is correct. Option number A is correct. Next, question number 187. Rohit multiplies a number by 2 instead of dividing the number by 2. So Rohit multiply a number by 2, but he have to divide that number. Okay, he had divide that number by 2. Okay, resultant number is what percentage? Okay, resultant number is what percentage? We have to find the correct value. Okay, so if you see, let number be X. Let number be X. Okay, so correct way is what? That is X by 2, but wrongly he take 2X, that is 2 multiply X. He multiply a number by 2. Okay, now how to find the percent? That is 2X upon X by 2 multiply what? That is multiply by 100. You can get the answer. That is X cancel by X, that is 400. That is 4%. That is option number D is correct. Option number D is correct. Okay. Now move to the next. That is, what is the distance traveled by a car which traveled at a speed of 80 km per hour for 3 hours and 30 minutes. So time is what? That is 3 hours 30 minutes. 3 hours 30 minutes. That is 3.5 hour, we can say that. That is 3.5 hour, we can say that. And speed is also given, that is 80 km per hour. 80 km per hour. So we have to find the distance. So distance is equal to what? That is speed into time. So 80 multiply 3.5, we will get our distance. 80 multiply 3.5, we will get our answer. We get our answer. That is 280 km. that is 280 kilometer. That is option number B is correct. Option number B is correct. Okay, option number B is correct. Now another question is, there are 90 members in a club. So there are 90 members in a club. 60 out of them are women's and remaining are men. So total is how much? That is 90. Women's, that is 60, and man, that is 40. Okay. Now the ratio of the man and women, now the ratio of man and women and man to total members respectively. Okay, we have to find the ratio of what? Man to women and man to total members. Okay, so first man to women and second is man with total members. Okay, like how to find? So if you see how many mans are there, that is 90. So total member is 90. So how many? That is men are 30. How many mans are there? That is 30. So if you see the ratio of man and women, that is 30 ratio 60. So that is 1:2. So ratio of man to women is how much? That is 1:2. Okay. So that is 1:2. So you can see that 1:2 is only in that answer, in that option only. Okay. So this and this and this is incorrect. So we can say that 1:2. 1:2. And if you see man with total ratio with total members, so how many are men? That is 30. So ratio 90, that is 1:3. So the answer is what? That is option number B. That is option number B. Okay. Now move to the next question. That is question number 190. Rohan invested rupees 4800 at simple interest for 3 years and received 2800 at interest. So how much interest is? That is 2800, and how much is principal amount? That is 4800. So time is what? That is 3 years. First we have to find what? We have to find the rate. Then we can use compound interest formula. We can easily find out our compound interest. So SI is what? That is P into R into T upon 100. The SI, P, T are given in the question. So 2880 is equals to 4800 multiply R multiply time is 3 years divided by 100. So this cancel by this. Okay. So the value of R you get is what? That is 20%. R is what? That is 20%. Rate is how much? That is 20%. Okay. So you have rate. Now you can easily find out amount. Amount is equals to P in bracket 1 plus R upon 100 raised to power what? That is 2 years. Here is time is 2 years. Time is 2 years. So 4800 in bracket 1.2. Okay, 1.2 whole raised to power 2. You will get your amount. Okay, you will get your amount. So what is amount? That is 69. When you solve it, you will get 6912 is the amount. You can easily find out CI. CI is what? That is amount minus principal amount. That is 6912 minus 4800. 6912 is equals to 4800. So CI is what? That is 21. Okay, 1 2. So option number D is correct. Option number D is correct. Okay, understood? Option number D is correct. So the question is, Rohan invests rupees 4800 at simple interest for 3 years and receive how much interest? That is 2880. Okay, he then invests the sum for 2 years at compound interest in same rate. So with the help of this, we can easily find out our rate. So with the help of rate, we can easily find out our amount, because amount, when we find the amount, we have principal amount, rate and time. So amount is what? That is 692, and simple interest is equals to amount minus principal. So we'll get our amount, our simple compound interest, that is 2112. Next, the average age of 3 boys is 15 years if their age are in the ratio, that is 3:5:7. The age of younger boy we have to find. The age of younger boy we have to find. Okay. Now do this question. Okay, that is very easy question. That is 3x plus 5x plus 7x divided by what? That is 3 is equals to what? That is 15 years. So that is 3x plus 5x plus 7x divided by what? That is 3 is equals to what? That is 15. Okay, so you can easily find out the value of x. When you put the value of x with the youngest boy, you will get your answer. You will get your answer. Okay. What is the answer? Okay, 9 years. D option, 9 years. Very good. So that is 12, 15, x is equals to 15, multiply 3, 15 cancel 15, that is 3. So value of x is what? That is 3. So the age of younger boy is what? That is 9 years. Okay. Now, some other question. 𝙂𝙂𝙎𝘾𝙬𝑛𝑠 received approval on 12/12/2025 primarily for the treatment of what? Complicated urinary tract infections, uncomplicated urogenital gonorrhea, या syphilis या chlamydial infection. What is the correct answer? What is the correct answer? What is the correct answer? 𝙂𝙂𝙎𝙬𝑛𝑠 received approval on 12/12/2025. It means 12 December 2025, primarily for the treatment of what? Treatment of what? That is uncomplicated urogenital gonorrhea. So option number B is correct. Option number B is correct. Next, 𝙤𝙤𝑘𝑜𝑙 was approved on 12 December 2025 for the treatment of what? Type 2 diabetic mellitus, hypercholesterolemia, hypertension, heart failure. For whom? 𝙤𝙤𝑘𝑜𝑙 was approved on 12 December 2025 for the treatment of what? You have 4 options: type 2 diabetic mellitus, hypercholesterolemia, hypertension, heart failure. What is the answer? That is, the answer is what? That is hypercholesterolemia. Option number. Active ingredient क्या है? Is what? That is 𝘎𝙤𝙎𝙎𝙎, that is approval in 12 December 2025. So to reduce low density lipoprotein cholesterol in adults with hypercholesterolemia in including heterozygous familia. Okay. Next is 𝘎𝙤𝙎𝑎 contains which active ingredient? Which active ingredient? You have 4 options. You have 4 options. 𝘎𝙤𝙎𝑎 contains which active ingredient? Barotracelate, donidalorsen, istibent. Which one? That is donidalorsen. That is option number C. That is option number C. Yes, that is donidalorsen. Next is the active ingredient present in 𝘖𝑃 JEE. 𝘖𝑃 JEE is the active ingredient present in 𝘖𝑃 JEE is what? That is cristinib, lorlatinib, taltrocitinib, osmeritinib. Which one? That is taltricitinib. That is option number C is correct. Option number C is correct. In FIFA Club World Cup 2025, in FIFA World Cup 2025, how many $1 million of prize money has been announced? How many? How many? $125 million, $130 million, $140 million, $180 million. How many money? In FIFA Club World Cup 2025, that is $125 million. $125 million. Next, what is the main fuel used in India's nuclear reactor? Uranium, thorium, plutonium, lithium. Which? What is the main fuel used in India's nuclear reactors? That is uranium. Option number A is correct. That is uranium. So in India, the main fuel used in its nuclear reactor is natural uranium. So the answer is what? That is uranium. On which date was Global Recycling Day celebrated? 15th March, 16th March, 17th March, 18th March. On which day? Global Recycling Day celebrated? 15th March, 16th March, 17th or 18th? Which day? That is 18th March. Option number D is correct. 18th March was celebrated for Global Recycling Day. Okay. Next, who has launched the energy literacy campaign? Reliance Industry, Bharat Petroleum, Tata Power, Adani Power. Which? Who has launched the energy literacy campaign? Reliance Industry, Bharat Petroleum, Tata Power, Adani Power. So answer is what? That is Tata Power. So Tata Power launched the energy literacy campaign. Okay. Now, where is the Forest Research Institute located? Where? Where is FRI located? FRI. Forest Research Institute is where? Raipur, Jaipur, Dehradun, Chennai. Where? I think all you know very well answer of this question. Where is FRI? Very famous institute. FRI is in Dehradun. That is option number C. FRI is in Dehradun. Option number C is correct. So FRI is located in Dehradun, Uttarakhand. FRI is an institute of Indian Council of Forestry Research and Education. Okay. So all the best to all the NIPER aspirants. You are champions. Definitely you will rock it. So don't be panic and be brave. Don't be panic when you see the question paper. Take a deep breath and you will definitely do the paper and you will rocking. You all are rocking. So thank you everyone for joining GDC and very all the best from GDC side for your NIPER exam. So take care everyone. Thank you so much.